but what's
Yeah.
really happening inside the body when an MS flare occurs? Does the immune system go off course in MS? Which players are most involved? T cells, B cells, microglia? I'm Selena Buongiorno, physician assistant, patient living with MS, and host of Miss Wired podcast. Thank you for joining me. Today's guest is Dr. Christy Kestner, a neuroimmunologist and medical writer whose work focuses on making science accessible and engaging. I'm thrilled to have her on the show to talk about the connection between brain, the immune system, and what it means for people living with multiple sclerosis. She's the founder of Brain and Beyond, a science communication platform making neuroscience, immunology, and oncology accessible through storytelling. Her PhD work examined how immune mechanisms, particularly complement pathways, drive neuroinflammation, and her postdoctoral research focused on oncology, drug discovery, and pancreatic cancer. Christy now serves as scientific advisor, writes for Endosymbiont, and contributes to MedEvidence, bridging the gap between research and public understanding. So thank you again for being here today.
Thank you for inviting me. I'm looking forward to our conversation.
Of course, I'm loving your content. So, what is neuroimmunology and what first drew you to the field?
Yeah, so neuroimmunology is really the study of how the brain and the immune system interact. And sometimes this conversation between the two goes wrong. So basically, it's really this interesting intersection just where inflammation, neurons, and immune signaling all overlap. But I've always been drawn to neuroscience. I think what initially piqued my interest is my grandma was afflicted with Parkinson's disease when I was a kid. So I was really always curious of the why behind this disease. And I think that's what always really made me interested in neuroscience. And so just kind of going from there, I was always interested in how complex the brain is. And then just kind of moving on to my PhD in neuroimmunology, really this happened by chance. Like the lab that I joined for my PhD was traditionally an immunology lab. And so when I joined, they had recently switched to more of a neuroscience focused a couple months before me joining. So it was really cool just to get that intersection of seeing how the immune system plays a role in brain injury. Like specifically, we focused on
Right.
stroke and traumatic brain injury. And really, this timing shaped just my career trajectory. And so I think what I loved most about this was just seeing firsthand how immune cells can both protect someone, but then they can also be a big driver for disease when something goes wrong.
Yeah, and I love a lot of your reels, like the TBI one, the traumatic brain injury one that you did was amazing. So
Yeah.
I saw on Instagram and I found you through your Instagram, which is Brain and Beyond. So tell us a little about that. Why did you start that?
Yeah, so this initially started as a passion project this past spring. So while I am a scientific writer full time, I think there's always been a disconnect with explaining science and research to the general population
I agree.
because, being a scientist or being someone that's in a clinician's office or working in a lab, most people don't understand what you're doing from day to day
Right.
and most people don't hear about it. And so I was just kind of going on Instagram and I've noticed a lot of the scientists that I had been following. I was like, you know what? There's a real niche for more educational content just to make it accessible for everyone, but engaging and fun. And so really that's how it started. I mean, I thought a few of my friends would follow and it's just taken off. So
That's amazing.
it's been really, really rewarding.
Yeah, and I saw you just hit 8,000 followers, I saw today. So that's
Yes.
huge. So good
I
for
know, I'm
you.
so excited. Thank
No,
you.
I love your content. And in simple terms, what actually happens in the brain and spinal cord during multiple sclerosis? Because, like you said, I started my podcast just for education and awareness because, like you said, people don't know.
Yeah, that's why I love what you're doing with your podcast. And so when you
Thank
immediately
you.
reached out to me, I was like, yes, I definitely want to just get more awareness out there. But yeah, so MS in itself, basically it's kind of what I was previously talking about with my background. Basically, it's your immune system that's going against and turning against both your brain and your spinal cord. So you kind of think of it in the terms of like friendly fire. So you have myelin, which is the protective coating of your nerve fibers. And, most people know this is what helps your electrical signals move smoothly. But in the case of MS, when your immune cells, specifically your T cells or your B cells, sneak into the brain and the spinal cord, that's what starts attacking the myelin. And so once this occurs, you have this insulation breakdown. And then you have these electrical signals that can slow down, or sometimes they stop altogether. And then that's what's causing those classic symptoms of, your weakness, numbness, vision changes, issues with balance. It really is an autoimmune disorder at its core.
Yeah, and a really good visual that I saw, like you said, kind of explaining it to the general public, was a phone cord that's been chewed on by your dog. So the phone
Yep.
cord may still work, but there may be an interruption in the wires, which is how I got the name for my podcast too, Miss Wired. And many people hear of lesions with multiple sclerosis, an immune attack, and the term flare, and
Yeah.
all of these things are thrown around. But what's
Yeah.
really happening inside the body when an MS flare occurs?
Yeah, so I think it's kind of what I was saying, that the immune system basically is mistaking the myelin really as an intruder. And so again, you're having this breakdown that's occurring around these nerve fibers. And so you have this inflammatory process that's being triggered, that's crossing the blood brain barrier, and then starts attacking the myelin. So like you said, you can think of it like a phone cord or electrical wires where they start losing their coating and fraying. So these signals aren't traveling properly. And so this is where you get most of the symptoms. But what's interesting is looking under a microscope, really these lesions are pockets of inflammation. So you'll have your clusters of immune cells, you'll have your damaged myelin. And so when your body is basically trying to clean this up and heal, that's when you have your scar tissue that's forming. And then that's what most people see as white spots on MRIs. But what's, good news is early treatment really makes a difference with this disease, as you
Right.
know. And, just over the past 20 years, we've just advanced immensely with all the immunotherapies that are available.
Yeah, prior to 1993, we didn't have any, and now there's over 20, so that's amazing.
Yep.
How does the immune system go off course in MS? Which players are most involved? T cells, B cells, microglia? I know a lot of the medications target different aspects of the immune system. Personally, my treatment targets B cells, so I was just wondering how it goes off
Interesting.
course.
Yeah, so I kind of like to think of the immune system as a GPS, and basically it's losing its direction of, basically its role. So basically with this disease, you have your T cells that are taking charge, they're leading the charge. And then you have your B cells coming in shortly after that are producing all these antibodies. And that's really what's adding the fuel to the fire. And then from there, looking at the brain, then you have your microglia that are coming in, which is your brain's immune cells. And so this is joining in, this is releasing a lot of inflammatory molecules. So again, I feel like the take home message is what's initially trying to start is protection quickly spirals into chronic inflammation. And so over time, not only does this inflammation damage the myelin, but your underlying neurons in your brain. And this is why some people have some symptoms that persist even when your flare ups settle down.
Like mine. And I know my doctor and I always talk about too, literally multiple sclerosis means many scars.
Yeah.
So even though that a patient does not have active lesions at that time, they're still active in the areas of the brain that cause, like I have, my biggest one is pain and numbness and tingling personally. And I have
Gotcha.
lesions in my brain and my spinal cord. And a lot of your work was on the complement system. So the complement system is something studied in other brain conditions. How does it contribute to neuroinflammation, particularly in myelin damage in MS?
Yeah, so this is really close to my heart because I study the role of the complement system in traumatic brain injury and stroke. And really, the parallels between those and MS is just so comparable. So basically, the complement system is part of our innate immune defense. So the overall goal is for this system to tag and clear pathogens or damaged cells. So in conditions like MS, basically, again, this is becoming overactive. And instead of protecting the brain, basically it starts tagging the healthy myelin and basically tagging it for destruction. So you kind of think of it as the brain's kind of cleanup crew that's accidentally putting trash labels on the wrong items, which in the case of MS would be your neurons. So once that happens, basically your microglia and other immune cells basically rush in to clear the debris. And then this is when you have this inflammatory cascade that is just driving more inflammation and more myelin loss. And, it's interesting, but it's also frustrating because this is the system, that's really meant to protect your body.
Right.
So, in a normal context, complement does help clear, these damaged cells and support repair. But in MS or TBI or stroke, basically the signaling just goes into overdrive, and then that's when it becomes neurotoxic. So I think just with a therapeutic mindset, which is what I did during my PhD, which I'm really curious to see where this frontier goes, is just targeting this specific complement pathway without fully shutting down the immune system. And it's, you want to restore this balance just between the cleanup and then the chaos.
Right. No, and they're having so much new research, like with
Mm,
BTK inhibitors and ways that we can target this disease without shutting down the immune system, like you said, so
yeah,
we're not considered immunocompromised.
yeah.
So, most of us with MS, or a lot of people, are on DMTs, which are disease modifying therapies. So, how do they work and how do they target the immune system, like you said, without completely shutting it down?
So, again, what's really cool about these is they're not suppressing immunity. Basically, it's retraining it. So, older drugs like interferon beta, so this kind of shifted your immune response from this inflammatory mode to a more balanced one, which is basically getting your helper T and regulatory T cells kind of chill out, to say, and just reducing the attacks on the myelin. Over time, you've had newer therapies that have come out like rituximab, which specifically targets B cells, which are, as you know, are the ones that produce these harmful antibodies. But what's cool with these is they're not wiping out all of your B cells. So what's really cool with this technology is patients can still fight these infections and respond to vaccines, which is huge.
Yeah, that's amazing. Because I know with a lot of people, like especially with my drug, I have to wait to time vaccines correctly so I'll have the maximum antibody response. And in your opinion, what does the future look like for remyelination or neuroprotection research? Can the brain repair itself?
So I feel like the brain always tries to repair itself. So it sends out these immune cells and other cells called oligodendrocyte precursor cells just to kind of rebuild this damaged myelin. But I feel like what makes it so tricky is the chronic inflammation. So it really makes it hard for these cells to properly do their job. But a lot of new research that is focusing on kind of boosting and amplifying these repair pathways, which can then protect these neurons from future damage from, down the road, where we kind of turn mess from this, stopping the fire per se, basically to making this into a disease where you're retraining the brain into rebuilding.
It's really cool. And where do you see the most exciting progress? Would you say it's immunotherapy, regenerative medicine, or precision targeting?
I mean, they're all really interesting to me. I think what's the biggest will be precision and personalized medicine. I think that's really going to be a huge step, really, with any disease and with vaccine development, because I think that's what makes a lot of autoimmune diseases so tricky is it varies differently from patient to patient.
Yeah.
No one is going to have the exact same symptoms. So I think if you can just tailor this treatment to each person's immune profile, that's really going to rethink about how we think about MS.
Yeah, because we do refer to it as the snowflake disease because they always say that no two cases are alike. So none of us have
No,
the same symptoms. So it makes it hard to
it's a
diagnose too.
challenge. Yep.
Hard to diagnose and treat because it looks like so many other things. So
Yep.
we talked a lot about inflammation, and I know I work in lifestyle medicine. So we're always teaching patients to live well in a low inflammatory lifestyle. And beyond medication, how much do you feel lifestyle factors like controlling your stress, which is a big one for all of us, sleep, exercise, vitamin D, how much do you
Yeah.
think all of that really matters?
This matters so much more than people realize. I think so many people just take this for granted where, oh, my doctor told me this, or I learned this in health class as a kid. This is something you should do. But I mean, if there's a part of it where prevention is key to your recovery. So, of course, sleep, getting, a full 7 to 9 hours of sleep, move your body, walk if you can't go to the gym, just move. Sunshine, like get out in the sun if you can, maybe for like 30, 45 minutes a day. This really, really plays a role in this balance of inflammation and your immune balance. And, this is not going to replace, obviously, your immunotherapy or medication,
Right.
but it does make the body a little more resilient and can really benefit someone in how they respond to their treatment.
Yeah, no, and vitamin D2 is such a big one because we all think, oh, we're in the sun, we got it. But in primary care, we would test people, and ideal levels are 50 to 80. Most of the people I tested were 17 to 23, especially people who
Gosh.
worked outside. We had one man who was a lawn maintenance worker, he was 17.
Oh my
Um,
gosh.
so he was really low. So, and we're in Florida, so we test a
Yeah.
lot of people. And I know that supplementation. So I always encourage people to see where your levels are at. Just ask your doctor for a vitamin D level because, like I said, we
Yeah.
think we're getting it and we're not. And I know there's a lot of misconceptions and myths about MS, and we all have them. What's one that you feel people need to know?
I mean, you know this better than anyone, but just something I've kind of observed. I think so many people just tend to think that always leads to severe disability. And that's not always true because it's such a varying patient population. And the biggest key as well is, the earlier you can have treatment and a very good treatment plan with your clinician. A lot of people live full active lives. And another thing, I feel like so many people think that brain inflammation, they associate this with permanent damage. And that's not the case either. We know that the brain is capable of these repair mechanisms. And also, we know that neuroplasticity is real, which helps with that.
Yeah, that's amazing too. And I think I agree with you. Even I'm in medicine, and when I got diagnosed with MS, I had no idea what it was. And my first thought was wheelchair. And I think that we really need to redefine that. Granted,
Hmm.
some people I like to acknowledge too that even if they do everything right, the disease may still progress. So there are people
Right.
that eat right, eat perfect, exercise, and it's unfortunate, but the disease will always take the course that it does, which is
Yeah.
unfortunate. And again, they did nothing wrong. So I always just
Yeah.
like to acknowledge that because that's an important one. But I think you're right that we have to kind of get that message out there that MS now is not the MS it was years ago before we had treatments.
Right.
And for someone newly diagnosed, what are the first things you'd like them to know and what gives you hope for the future for them?
So, as you said, basically, MS now is not what it was 20 or 30 years ago.
Right.
That we have more than 20 FDA approved therapies. And I think what's really cool about the newer ones that are getting FDA approved, that's kind of dualistic in the fact that they focus both on this neuroprotection aspect, but then also the mechanism of repair. And so I think overall, what gives me hope is just all the collaboration that's been going on with clinicians, scientists, even patients, just bringing more awareness like yourself and all working together. And I think overall, having this cohesive partnership is really what's moving MS care forward.
No, of course. And now in research, we have things that will help with the neurodegeneration, like you said. So it stops the
Yeah.
progression of the illness, as
Yep.
well as controlling that inflammation in one medication, which is huge because we don't
Yes.
really have anything else like that. But thank you, Dr. Kestner, for such a clear, empowering look at brain health. Do you have anything else that you want to add?
Thank you for hosting me today. This has been so fun. And, it's been fun just watching your journey and just getting to
Thank
know
you.
you. And I feel like you've honestly kind of brought more awareness to me for MS because I felt like when you initially reached out, I didn't know too much about it, just kind of
Right.
the basics. So I was like, okay, this is fun for me kind of in my neuroimmunology brain just to kind of like go more in the deep dive, learning more about just the immune mechanisms.
No, and
So,
I love your content. Like I said, the traumatic brain injury, all of the different things that you do, stroke, and you talked about Alzheimer's, and we have a lot of research in that as well. But make sure to follow her work on Instagram if you're not. It's at Brain and Beyond. And don't forget to follow Miss Wired Podcast on Instagram or Facebook for more expert insights into real life perspectives on MS and brain health. So thank you again.
thank
And the
you.
full episode will be available on Spotify, Apple Podcasts, and YouTube. And as always, thank you for listening and being part of my journey.